Dresslers Syndrome. So Dresslers Syndrome is a form of pericarditis, and there will be an inflammation of the outside of the heart, that is surrounding the heart. It is believed to occur as a result of any immune system responding to damage of the heart tissue or damage of the sac around the heart. So this damage can occur as a result of heart attack. So the causes of Dressler syndrome, and even the Dressler syndrome, we can call it as a post-myocardial infarction syndrome or post-traumatic pericarditis, and because it used to cause after myocardial infarction and after open heart surgery or any heart procedures such as cardiac ablation or any implantation of permanent pacemaker, and as a result of chest trauma from an accident or previous use of long-term use of prednisolone like corticosteroid, and any viral infection and any previous pericarditis. The pathophysiology, so what will occur once the patient had a history of heart attack? There will be an injury in the myocardium. So the myocardial injury results in myocardial antigens or new antigens will be started producing in the heart tissue that will stimulate the immune system, and finally it will inflame the pericardium and results in pericarditis. And the symptoms commonly occurs after weeks or months after a heart attack and a surgery or injury of the chest. And the symptoms mainly the patient may feel fatigue, weakness, and there will be a fever, chest pain that will be worsened at the time of lying down and can be felt in the chest, upper back of the left shoulder, and can pose with activity. And even the patient may be having the complaint of labored breathing, and they may feel more difficult to breathe when they are in lying position. And even the patient may complain of tachycardia, that the heart rate will be above 100 beats per minute, and pericardial effusion, so that is the fluid buildup between pericardium and heart, and they may feel the severe pain in the joints and less desire to eat. So how the Dressler syndrome diagnosed? So mainly it will be diagnosed by doing some blood test, that is complete blood count or blood culture to rule out the infection, and there may be an elevated C-reactive protein, and ESR also will be elevated there. So all this shows that the patient has the signs of inflammation. And electrocardiogram, there will be an abnormal electrical activity which suggests that presence of pericardium. And the chest X-ray, we can see there will be an increase in cardiac heart size, that is due to fluid built up in the heart. So the medical we will say it is a cardiomegaly. And echocardiogram, so why we are doing echocardiogram means, so here we can detect the presence or absence of fluid around the heart and the pericardium or lining around the heart muscle, and even we can measure the adverse impact this fluid may having in the heart muscle. Then cardiac magnetic resonance imaging, MRI and CT scan. So this is more useful in the follow-up for checking the thickness of the pericardium, or whether it is compressing the heart from the thickened pericardium or what. So how the Dressler syndrome treated? So the common thing we will treat by giving the anti-inflammatory drug. So common medicine choice, that is aspirin, and or ibuprofen or naproxen we will use. So the high dose aspirin, that is 750 mg or 1000 milligram every 6 to 8 hours we will give, or ibuprofen 600 to 800 milligram every 6 to 8 hours we will give. So if the patient, anyone can't take aspirin or non-steroid anti-inflammatory drug, we can prescribe Polkin or steroid. Complications of Dresslers syndrome, it is very difficult. It can be bring into a life-threatening condition. So we have to monitor the complication and immediate measures should be taken. The first complication is cardiac tamponade, that is caused due to excess fluid buildup in the pericardium, which puts extra pressure on the heart. So what will happen? It will give severe compression of the heart, interferes with the ability to function. So as a result, what will happen? There may be a chance of drop in the blood pressure. So this will be very dangerous condition. And constrictive pericarditis, that is hardening or thickening of the pericardium, which will impair the heart function. So the heart may compressed and there may be a backflow of blood to the lungs. Uh, Coming to the nursing management, monitor the pain level and evaluate pain within 30 minutes. Administer prescribed medicines such as morphine to relieve pain. Monitor the patient pain level and effectiveness of analgesics. Provide comfortable position. Mainly, the patient will be comforted by sitting position. And check the vital signs. So to rule out the signs of infection and signs of symptoms expanding because there may be a chance of developing aneurysm. And in case of surgical intervention needed, we have to use psychological support and reassure the patient. And in case the post-surgical patient, we have to always discuss the warning signs of post-operative complications like fever, inflammation in the surgical site, bleeding and swelling. And daily we are supposed to monitor the weight and whether the patient has any persistent cough, vomiting or systolic blood pressure above 180 mm of hygiene. So that also we should check it and ensure the blood test, monitor for any chest pain or friction rub, and check the saturation. If the saturation is less than 90, start oxygen and administer non-steroid anti-inflammatory drug, and antibiotics should be given at time. And we should continue the antihypertensive medicines till the patient maintaining the normal blood pressure. And strictly, we should maintain the intake and output chart and monitor the chest pain, check signs and symptoms of cardiac tamponade at least 8 hourly, and assist the patient with the bathing and the bedside commode should be given in order to reduce the stress of the patient. And even we can make the patient to do some minimal activities and always do rapport to the patient to reduce anxiety. Thank you.